Officials in Ohio, they are warning about an increase in pneumonia cases among children. Since August, hospitals have reported more than 140 cases of pneumonia called white lung syndrome. Also in Massachusetts, doctors are warning of a rise in walking pneumonia. Here with us live now is talking about the surge and the outbreak here. We have Dr. Amesh Adalja with the Johns Hopkins Center for Health Security. Dr. Adalja, good morning. Thank you for joining us. Can you first walk us through what is going on with this illness in particular?
This is not just one single illness. What this is a whole group of respiratory pathogens, viruses, bacteria, things like flu, COVID, and RSV, and rhinoviruses, and mycoplasma, all infecting children at once as we get into respiratory disease syndrome and season. And what we're seeing is in some parts of the world or in some parts of the country that there are a lot more than normal, and that's what we're hearing about. This isn't anything to be alarmed about. This is respiratory season, and lots of viruses and bacteria are circulating right now, and they are getting children sick.
Why do you think we're saying this particular issue, though, now?
One is that we're right in December right now. This is when traditionally all of these viruses and bacteria start to circulate. They've been kind of on hiatus during the pandemic when all that social distancing and masking was going on. And some of the immunity in the population may have fallen, so they're all coming back at once the way they did last year with RSV, for example. But this doesn't really necessarily seem to be above the historical baselines. We've had 3 years where we haven't had this. We've only had COVID. So this might be something that people are alarmed about because they don't remember what respiratory season was like in 2018 or 2017, for example. But we're not seeing it being much higher than what those historical norms were.
So we know that symptoms can sometimes be shared with different illnesses. What should parents look for in this case?
Well, you can't tell any of these diseases apart. It could be COVID, it could be flu, it could be RSV, it could be mycoplasma, it could be whatever it could be. You have to get testing to know what it is. But the things that really need people to see their doctor are if someone has severe shortness of breath, someone has an unremitting fever that can't be controlled with Tylenol or ibuprofen, if someone can't perform their activities of daily living, meaning they're so fatigued, so exhausted from this that they can't actually do anything. And if any child has any high-risk condition like asthma, they're immunocompromised, those children should have a low threshold for medical attention.
Dr. Amesh Adalja, thank you so much again for joining us and for sharing on this very important issue we're seeing now.